This is Average Joe PT, and today we're going to talk about joint manipulations. Isn't that right, Skully?
We're going to crack some backs.
That's right, we're going to work on that, so I want you to stay tuned. Now, joint manipulations are done by a couple different professions. Physical therapists can do them, chiropractors can do them, physicians of osteopath can do them, and so it's always oversaturated in the chiropractic community when you should have one, when you shouldn't have one. But let's go ahead and take a look at a manipulation. Right there, you can see one being done where they essentially open the spine, then they turn the joint in a certain position, and then they go ahead and pull at the very end. And what's that really entail? Let's go ahead, we're going to zoom up to it right now. Now, as you can see, when you zoom up, all you really do is they're opening the joint so that the backside is really open in one spot. And they lock the joint in at another spot, and then they cause a thrust at the very end. And what you're hearing is that snap or pop is this joint on the either side is what they call cavitation, where there's gas or air bubbles within the fluid within these joints that actually gets released. So it comes up, they open up that joint space, and then they cause the joint to go at the very end. Now, why do you need or not need a joint manipulation? So when we go ahead and look at that, you might need that joint manipulation if you can't move a certain way. You can't rotate, you can't go backwards, you can't go forwards, you start having a lot of joint pain, that facet joint, which if you take a link up there and click on that after this video, you'll see all different types of techniques with back pain and specifically facet joint pain and why sometimes you need a manipulation. And that is sometimes need a manipulation. Every time you have back pain, you don't need to have a manipulation. So that's one thing that's unfortunately overutilized in a lot of the profession, hence chiropractic, is the joint manipulation. Now, there are multiple stages or phases to a joint manipulation. And from a grade 1 to a grade 5, and the grade 5 is what everybody known as is the crack or the pop. You don't always need that particular technique as a whole. Now, hopefully you can leave a positive, negative down below. I'd love to hear all about it when it comes to why or why not you need a joint manipulation. If you have any questions on that joint manipulation technique, you can go ahead and give me a shout out. Isn't that right, Skully?
We want to hear the negatives and the positive, people.
You can hear both sides of it. You can hear the positive and the negative, why everybody needs a chiropractic or a manipulation as a whole, or why they don't. It's interesting sometimes how people in the profession rationalize why you need a certain technique or don't need a technique. So let's go ahead and show you another pic here. This is really showing a good view of someone on their side and having a manipulation done. A lot of times, or you can have the bad ones. There's a ton of videos out there on the wrong way to have a chiropractic technique. So when should you or when should you not have a chiropractic manipulation or manipulation as a whole done to you? Number one, if you're having back spasms so bad that you can barely move and you're hunched over, the last thing you should have done is some sort of joint manipulation. Whether it's a grade 1, which is basically nothing, they're just kind of tapping on your back, to all the way to the grade 5 where they're manipulating your back and you hear that big crack and pop. So that's number one. Number two, any symptoms that's down your leg, numbness, tingling, burning, you can't move your ankle or foot for some reason, the last thing you should have is a joint manipulation done by a chiropractor or anybody else for that matter. So those are two main symptoms. If you're having those, you definitely don't want to have a chiropractor or any type of manipulation done to your spine. You want to rest it, ice it, reduce the stress on that joint completely, probably take some anti-inflammatory drugs, so that's also reducing the inflammation around the joint to try and help you recover instead of having a joint manipulation done. So If you have any further questions on that, I want you to stay tuned. All right, if you guys have any further questions, I'd love to have you leave a positive or negative down below. Click on my next link here to go over some more techniques, treatments that you can do at home to reduce your pain. Where the heck is the pain coming from in the first place? So until next time, Skully and I always like to say, look up and keep smiling. See you next time, folks.